Good afternoon. My name is Carlos Sanchez. I'm Director of Public Affairs for Hidalgo County. I want now to introduce us to Eddie Olivares, who is head of the Hidalgo County Health and Human Services Department, to give us an update regarding the COVID situation. Go ahead, Eddie.
Good afternoon, everyone. This is Eddie Olivares. I'm the Chief Administrative Officer for Hidalgo County Health and Human Services. And I have some updates on some of the COVID information that we've been working on for the last several weeks. As you know, we had made a press release a few weeks ago in regards to we had many thousands of positive COVID cases that have been done by local vendors, doctors, pharmacists, different agencies here locally. And it really was an influx of testing that took place right around the time of Christmas and the holidays into the new year for people who were traveling abroad or traveling to other parts that required testing before they traveled. And then they required testing upon return because of their exposure. So we've processed many thousands of tests that have been submitted to us by the local vendors and different agencies for testing. For example, the amount we're going to talk about today, we processed the first initial batch of 33,000 were processed. And out of those 33,000, we're going to report that we have 23,200 that are going to be reported tomorrow as positives. The difference was that we had 9,000 duplicates and errors. So this is a very, very detailed review of all these tests. That does not include the tests that are being done by our local vendors. We have upwards of 120 local vendors who actually provide COVID testing locally here within Hidalgo County. And they are submitting their data directly to the state. Those numbers then are reported to us from the state, and then we process those numbers. So in the weeks to come, you're going to start seeing large batches of positive tests from COVID. But those have been the batches or the tests that have been done over the last several weeks, but not only by us, but by local vendors. But it's very important that we adhere to the understanding that the Omicron virus is the primary virus we're seeing, the primary type of COVID. It is here in our community. It is very important that our public needs to understand that the vaccinations are essential to help limit the number of people going into the hospitals and to limit the amount of illness that occurs. The COVID vaccine does not prevent you from getting COVID. I want to make that very clear. It just lessens the symptomology and lessens the amount of illness. Now, to be very frank and clear, we've had over 3,627 fatalities in Hidalgo County from COVID. We've had some fatalities are people who are fully vaccinated. But the reality is, in many of those deaths, which is a small percentage, but many of those deaths are due to very severe comorbid issues, co-occurring issues, cancer, advanced heart disease, other serious medical complications that the person contracted COVID even after they were fully vaccinated, and they got medical conditions that were very, very difficult to handle and unfortunately passed away. We also need to acknowledge the fact that there are many local partners assisting us with this. I have to acknowledge all our local pharmacists, our doctors, everyone who's actively working to try to support us with this COVID testing and support. The number of tests, though, when you look at it proportionally, the number of tests that are positive to our hospitalization does not compare to the Delta. However, it is still very serious number of patients. As of this morning, we had 401 people in the hospital who have COVID, and 373 of those were adults, 28 were pediatrics, 92 adults in ICU, and 4 pediatrics in ICU. But the number of positive COVIDs is extremely high, but the ratio to hospitalization is less. But this is the importance of the testing. The testing is important for people to isolate themselves, to be able to know how to handle the situation with their work and how to respond to work and school. We still encourage people who test positive to follow CDC protocols and isolate and continue to wear your mask, wash your hands, and be able to follow all the hygiene protocols that we've known for the last 2 years. Today, we're at 698 days of operation. We're almost hitting 700 days of operation. So this is something that we've been dealing with for the last 2 years. That's my overall briefing today. I'm open to questions or comments from anyone.
Before we take questions, I want to let you know each reporter that I'll call on will be allowed one question and one follow-up. I am going to call on the reporters in the order in which you signed on. So let's begin with Yoselyn Castellanos with Univision.
Hola, muy buenas tardes. ¿Podría repetir brevemente las cosas en español?
Sure. Muy amable, Eddie Olivares, el administrador del Departamento de Salud y Servicios Humanos para el Condado de Hidalgo. Hoy mismo estamos aquí para anunciar los resultados y dónde estamos en nuestros análisis de COVID en nuestra comunidad. Como todos saben que empezando en el mes de diciembre, como la Navidad, el Nuevo Año, ha habido miles y miles de personas que han hecho análisis o pruebas para COVID testing aquí localmente en las farmacéuticas, con los oficinas de doctor, en los hospitales, aquí en las clínicas del condado. Se ha hecho bastante de esfuerzo para hacer las pruebas de COVID. Hemos ido a este punto que quiero reportar. Hemos tenido miles y miles de casos que se han reportado positivos de diferentes agencias locales. Se hizo un análisis del primer grupo que hicimos, más de 33,000 análisis. De esos 33,000 análisis, 9,000 son duplicates o son, ha habido errors o no tienen complicaciones en cómo se administraron. Es para nosotros. Ahora vamos a reportar 23,200 casos que vamos a reportar en la mañana, que son positivos y han estado revisados para asegurar que están bien. Pero eso es lo primero que se está haciendo. Otra cosa que es importante, que cada agencia local, doctor, farmacéutico, hospital, etcétera, más de 120 diferentes agencias que están dando las pruebas de COVID, ellos son responsables para poner los datos y la información al nivel estatal. Ellos son los que entran toda la información al nivel estatal. En las semanas que vienen van a ver números que van a aumentar o crecer en positivo aquí localmente, porque la situación es que todos esos datos están entrando apenas ahorita al nivel privado y local. Hay que estar al tanto de esa situación también. Pero lo que es importante que es el porcentaje de casos positivos de Omicron, de COVID, a relación a los números de las personas en el hospital. Hoy mismo tenemos 401 personas en el hospital. De esos 400, 373 son adultos, 28 son adolescentes o pediatrics o niños, 92 adultos en ICU, 4 niños en ICU. La relación de positivos a personas en el hospital no es tan alta como cuando tuvimos la situación de Delta variant, pero es importante que todos consigan su vacuna. La primera dosis, segunda dosis, el booster. La vacuna no previene a la persona de contagiarse de COVID. Lo que hace es de la oportunidad que no se enferme tan seriamente con COVID. Desafortunadamente hemos tenido personas en el hospital que están completamente vacunados y han muerto. Por ejemplo, hoy mismo ayer tuvimos 8 personas que murieron. De las 8 personas que murieron, 7 no estaban vacunadas, 1 estaba vacunado completamente, pero desafortunadamente esas personas están muy enfermas con cáncer, complicaciones de corazón, otras complicaciones médicas. Hay que reconocer la importancia de las pruebas, pero hay que reconocer la importancia de la vacuna también.
Any follow-up?
Yes. Estos números que están reportando no incluyen los exámenes caseros, ¿correcto?
No, porque cada agencia está responsable para entrar los datos directamente al estado. Y nosotros, si son caseros de otras partes, de otros lugares, depende de la agencia donde fueron a las pruebas.
Ok, muchísimas gracias.
Next we go to Sara Garcia with Telemundo.
Sí, ¿qué tal? Buenas tardes. Regresando al tema de los test caseros, los exámenes caseros, esto quiere decir cómo las personas, si están recibiendo, por ejemplo, los test del gobierno para aplicárselos, dónde ellos pueden reportar esto, cómo el condado está con seguimiento con las personas que están positivas en su casa.
So, por ejemplo, el doctor Meléndez hizo un anuncio últimamente tocante ese tema aquí para el condado de Hidalgo. Si una persona compra las pruebas locales en las tiendas, recibe las pruebas del gobierno, ahorita mismo esas pruebas no se tienen que reportar al condado. Les pedimos a todos que si tienen una prueba positiva de COVID en su hogar, si lo toman en su hogar, si lo compró en el internet o por el gobierno o por una tienda local, que por favor sigan las recomendaciones del CDC, que se aíslen en su hogar por los 5 días a 7 días, que es importante que si tienen síntomas, que no vayan al trabajo, no salga y que se comunique con su médico para instrucciones y que lo guíe su médico tocante a los resultados de esas pruebas.
Any follow-up?
No, es todo. Gracias.
Next, we go to Tylisa Hampton with KVEO.
So just to be clear, are you saying that you expect these high number in COVID cases because vendors sent their data to the state?
Correct. So we're looking at, in the weeks to come, days and weeks to come, don't be surprised if you start seeing large numbers because all that data is finally catching up. So it takes anything from 20 to 30 minutes to input one case into the state system. And by the time you process that, and then those cases come back to us, we have to review them, process them, and look to see if there's any duplicates, any errors, etc. So we're always reviewing all the data. So it's very timely, it's very difficult to review all that. Before, we're able to keep up with all of that because we didn't have the number of tests that we do now. When all of a sudden, right after the holidays, right around during the holiday time, we just got thousands and thousands of people testing every day. And so it became a very difficulty logistically to keep up with all of that.
Any follow-up, Ms. Hampton?
Yes, at what point do you think the testing will slow down to the point where y'all won't have as many COVID cases?
Oh, that's hard to tell, ma'am. I could not predict that, but it'll take several weeks. As it is right now, I see it every day in different locations. There's many hundreds of people in line for testing each day. And then now we have testing at home. We have testing through the internet. You can procure, you can testing in the big box stores. Hidalgo County for right now is not asking folks to report those to the county. What we are asking is that if you're positive, follow CDC protocols and guidelines, and also to contact your physician for guidance and direction, because there's thousands of those tests being delivered to homes every day.
Thank you, Tylisa. Next, we have Monica de Anda with KRGV.
Hello, Mr. Olivares, can you hear me?
There's a little bit of an echo and skipping, but go ahead, Monica.
Okay, I've turned on my camera. Asking really quickly about, you mentioned how the rate of hospitalizations is lower this time compared to Delta, even though we have more cases. Why do we think that is? It's because testing is more widely available? Is it because people are vaccinated? What are the factors behind that?
I think there's several factors, and that's a great question, Monica. Thank you for such a good question. I think one of the main things here is that, one, we have so many more people vaccinated. We have one of the highest rates of vaccination in the state of Texas, here in Hidalgo County, Cameron and Starr and Willacy County, here in the Rio Grande Valley. But additionally, it's also important to acknowledge the fact that a lot of people have gotten COVID. There is natural antibodies developing in our community. There is natural support developing in our community. So between vaccination, natural antibodies, also that the reality is that the Omicron itself is very different than the Delta. I'm not lessening its severity because people are dying every day. We had 8 people die yesterday with COVID. So, but the reality is that I think that the protections from the vaccine and from natural antibodies are there. More and more people are cognizantly aware of what protocols they need to follow. However, I do not want to downplay this, Monica. Please hear me clearly. This is still very dangerous. It is very lethal when you have people dying every day, and when you have upwards of 38% of all the staff beds in Hidalgo County have a COVID patient in them.
Any follow-up?
Yes, one follow-up question. Why is it at this time that Hidalgo County doesn't want to get people's at-home COVID test results? Why is that decision at this time?
Well, we're following also what the CDC is doing and also what the state of Texas is doing. The CDC and the state of Texas are not reporting the home tests to the county health departments. And the reality is they're considered as suspected cases. They're not considered as confirmed cases. So that's why it's important that you follow up with your physician, follow the protocols as indicated by the CDC, and isolate at home. So it's not a requirement from the CDC or the state to report those cases.
Okay, thank you.
Thank
Ms.
you,
Olivares.
Monica. Finally, we have Isamar Terrazas with Azteca.
I can't hear him, Carlos.
Isamar, you're on mute. Is it your intent to ask a question?
There was something on chat, Carlos. I'm not sure. Can you check, see what it said?
Yeah, we've handled that, Eddie.
Okay.
So with Isamar's absence, that concludes today's media briefing. This event has been recorded. We will be sending a link as soon as it's available to all the media outlets. We thank you for your time, and we thank you for your guidance, Mr. Olivares.
Thank you. Have a good day.